Hello, my name is Hannah Klushnik, and this is a video demonstration of the wrapping technique of a residual limb for a patient with a below knee amputation. This is my patient, Mr. Smith. He is sitting at edge of bed with his intact foot down on the ground and his residual limb extended at the knee. Mr. Smith, I'm going to show you how to wrap your residual limb. It is a very important technique to learn because it will help you reduce the swelling, shrink and shape your residual limb in order to fit a prosthesis on it later when it is time to do so. There are four main principles that we need to follow when we wrap the residual limb. The first one is you always want to make it tighter towards the end and looser as it gets closer to the trunk. The second, that is because that is how the swelling will get reduced at the tip, which is what we want. The second principle is you want to avoid strictly circumferential wrapping. You want to wrap it in a figure-8 manner, as I will show you in a second. And then two more principles are no wrinkles. So if you happen to create wrinkles with your tape or with your ace wrap, just undo it and redo it, trying to avoid it. And no opening. So you want to make sure that there's no skin showing when you finish the wrapping. So I'm going to be using the ace wrap. This is your kneecap. I'm going to place it in a diagonal manner below the kneecap and then start wrapping it in a figure-8 manner as I told you before. Okay, so again, making sure that it's fairly tight at the bottom and not as tight towards the top. So once I have done two sets here, I'm going to go above the knee and do a somewhat circular wrapping here, but it should be really loose. This is my anchor. And then once I am here, I'm going to go back down, covering everything that I haven't covered yet. Now, because I'm using a shorter wrap, it will end before I have finished. So what I'm going to do is I'm just going to fixate it here using medical tape. I'm using regular tape for demonstration, but you want to avoid using staples because that might damage your limb. And then once I have fixated here, I'm going to take a second wrap and then just finish going around, making sure there are no openings. And at the very end, when there's just a little bit left, I would do another circular wrap at the top and fixate it again without using any staples with tape. And that would be when I finish the wrapping. Thank you very much.